Well, government is locked in a crisis meeting as we speak ahead of President Cyril Ramaphosa's address to the nation tonight. The third wave of infections has soared, especially in Gauteng. The Delta variant has added lots of fuel to the fire. Well, will we see harsher lockdown restrictions? Gauteng Premier David Makhura has said the province can't afford a complete shutdown at this point. Well, eNCA's Heidi Giokos is following that story. And of course, the big talk at the moment, especially today, Heidi, is about vaccines and how effective they are against this third variant. What are we hearing from the experts so far?
Yes, and we do know that the President is currently speaking to experts, government officials, to discuss what the plan is going forward, and hopefully they will put more pressure to expedite the vaccine rollout, because it seems at this stage this is extremely crucial given the fact that the Delta variant is extremely transmissible. But the big question that's come about is whether or not our vaccines are effective, due to the fact that we know that a government decided to not roll out AstraZeneca because it was not as effective against severe illness when it came to the Beta variant that was driving the country's second wave. Now we have a new variant, the Delta variant, that was identified in India, and we know that that is driving our third wave. The question is AstraZeneca going to be rolled out in the country? We know it's effective against the Delta variant, and many people are asking, but why was this even put on hold if we know that AstraZeneca had some efficacy against severe illness and hospitalization. But we know that government is discussing this, and it could possibly be a consideration. But of course, they have to go back to the drawing board and see whether or not the infections of the Delta variant is high enough to roll out another vaccine that's more effective against Delta. But let's listen to the co-chair of the advisory committee.
We just need to recall that when we could not use AstraZeneca in the country, it was because of its very poor performance and efficacy on the Beta variant. And so I guess the question then that Dr. Nyati is asking is, if then we get to be actually shift the infections to actually the Delta variant, which we have seen that it actually, the AstraZeneca vaccine works well against it. Is that a possibility? My response would be, we actually would need to explore that and see if that might be something we want to consider. Firstly, we need to use the vaccines that we have currently, in the country. And then secondly, it will be a matter of looking to see how much, Delta variant do we then see in the country across, which would make us to go back and reconsider AstraZeneca. But for now, it is something that we're going to need to look at and try and collect the data and see if it is an alternative we could explore into the future.
Well, Heidi, as you know, I spoke to Professor Shabir Mahdi just about over half an hour ago on the show here, also saying that, yes, we probably should not have let go of the AstraZeneca. We know he's long been an advocate for keeping it to sort of treat very serious illnesses as well, and also saying that we need to now be innovative about how we use what we have at the moment.
Yes, very insightful interview there, because what he's basically saying is that government failed to listen to advice from the World Health Organization when in January already said that countries should still roll out AstraZeneca despite the fact that it's not as effective against mild diseases when it comes to the Beta variants. And what's interesting about that interview is that it seems as though we are trying to stop transmission. We are trying to stop people from getting mild COVID-19. But the issue here is we need to try and stop people from getting into hospitals. And if a vaccine can stop that or prevent that to some extent, that should be considered. And basically, Professor Mahdi coming out hard on government, and this is not the first time we're hearing this. We're hearing Professor Mahdi saying government miscalculated with AstraZeneca. It was a vaccine that could have been rolled out. It could have been effective for severe hospitalization of COVID-19, which is what we are trying to prevent now, which is what hospitals are saying we are not coping. And with the Delta variant being highly transmissible, perhaps government needs to think about that and needs to have a conversation about the AstraZeneca vaccine. But let's listen to Professor Mahdi on how government possibly miscalculated with AstraZeneca being put on hold.
The World Health Organization has indicated that even in countries where the beta variant was dominating, those countries should still continue using the AstraZeneca vaccine. South Africa's government and its advisors decided to go against the World Health Organization decision at that stage, and it has come back to haunt us. What does evidence currently show? It shows that AstraZeneca vaccine still very likely would be able to protect against severe disease due to the beta variant. But in addition to that, what we now see is that AstraZeneca vaccine, in fact, is protection against hospitalization due to the Delta variant. In a recent analysis completed in the United Kingdom, shows vaccine effectiveness of 75% after the first dose and 92% after the second dose. For less severe disease, as you mentioned, around about 60% protection. But what we're wanting to do is really, it's all about saving lives rather than preventing these mild illnesses, which most vaccines would come short when it comes to the beta variant and possibly the Delta variant as well.
And I also asked Professor Mahdi about what you had said in our earlier interview, Heidi, about J&J, what we're hearing, that it might also be quite effective given a booster as well after that, because J&J is one shot as far as we know, and that's where he said we need to start being more and more innovative. But just back to the point of what seems to be government's knee-jerk reaction to everything. Oh, this doesn't work. Okay, let's get rid of it. Okay, let's get that. Let's get this one. It makes you wonder whether we're being advised or whether they're being advised properly. And he also criticized them for not listening to the World Health Organization as well. So where does that leave us? What are your thoughts?
Yes, certainly. And this is why I posed a very, many people would say, angry question yesterday.
On Twitter. Yes, you did. I saw
yes, and also on the health group to say, why must it always reach crisis level before government has a press conference to say this is what's going on in the country? We knew that the Delta variants arrived in May already. Masego had interviewed the health minister where she was told by the health minister then that she's causing unnecessary panic because the Delta variant is in the country, but they're controlling this. They always say we're controlling the situation, and then a few months later, not even months later, we find ourselves in this very unpleasant situation. So hopefully there will be some intervention, and hopefully the president will say something more needs to be done. And many people say, you know, the vaccine rollout isn't the answer, but at this stage it seems as though that is the only answer. We should have been rolling out vaccines as quickly as possible from the very beginning, because it seems as though that is providing a solution. And many are saying, but people in the UK are still getting infected with COVID-19 after 60% of their population has been vaccinated. It's a very different situation there, because it's mild COVID-19. They have very low hospitalization at this stage, which is what government needs to try and avoid and tackle as quickly as possible. So hopefully the president won't be watching right now, but if somebody can just tell him, vaccinate as quickly as possible.
And I suppose, it's, you know, the naysayers might say, regardless of what he says tonight, whatever he does, do we still get the feeling that it's going to be too little too late?
And that's the big question here. How do you put a country into level 5 lockdown again after we saw what it did to the economy, what it did to people's lives? It's about lives versus livelihoods. How does the president balance this? But this is why the president needs to say, what other options do we have? The option is to vaccinate. We need to find funds to get as many vaccines as possible into the country quickly as possible to vaccinate. So many are saying it's too little too late, but, you know, I always try and hope that there is some silver lining somewhere. And hopefully we can get a solution as quickly as possible, and it's not level 5 where we've seen how severe that impact can be.
Yeah, and I suppose it's let's just hope there are some lessons learned from there. But on that note, Heidi, before I let you go, you spoke about well, we all know our facilities they're just at the bottom of the barrel now. They're struggling to find beds. We're hearing all those, especially here in Gauteng, about those who have to be taken out of the province to be put into hospital. And I spoke to Nehao earlier also saying what happened to the field hospital in Nasrec, and I know you asked about that and saying that it had to be closed, it was too expensive to keep running. What does it take to get it up and running again? Also, we have other hospitals that are not, you know, fire at Charlotte Matreke as well. We have that going on. There's so much going wrong. What is being done to fix those or get that into action? And how also saying it's time to stop getting people to the vaccines, get the vaccines to the people. What are you
Certainly,
hearing?
and you know, when the briefings happen and you ask these questions, people become very defensive. The Premier becomes defensive. The MEC of Health and Gauteng became defensive to say that Nasrec, for example, was a field hospital and it wasn't meant to provide support in ICU and high care for COVID-19. It was supposed to be for isolation. But that's what we need right now. We need people to isolate away from their homes or crowded spaces so that they don't spread the Delta variant and don't spread COVID-19. So this is the issue here, is that there are so many problems and there's never a solution. It's always reacting very late. And right now, Gauteng cannot afford to have any more of this. You're hearing the doctors, you're hearing hospitals say we have no capacity. And yesterday they said there was an allegation that patients are being moved from Gauteng to KZN. It's not an allegation.
It's not an allegation, yeah. I've heard from medics themselves who work for different companies saying that somebody had to be airlifted, example, to a hospital in Richards Bay just over a week ago. So it's not allegations. These are people who are seeing it happen.
Exactly. So the message is clearly not getting to government to say there is a crisis, there is havoc in Gauteng. And hearing from what was said yesterday, the Delta variant is most likely going to move into other provinces as well.
If it hasn't already, and people are just not getting out to get tested, that's the other question we were asking. We're seeing low numbers. Does it mean that the numbers are not higher, or does it mean that people are just not going out to actually get tested? We don't know what the real story is.
Exactly, yeah. There's a lot going on, but hopefully there will be some clarity in the next couple of hours.
Oh, let's hope that it is what we need. Thanks very much, Heidi Giokos. She will be watching this very, very closely, as she has been for, well over a year now as well. Heidi, thanks so much.